Bismillah ar-Rahman ar-Rahim. As we are going together to start, once we started our lecture about communication and our story when we started first lecture, how to prepare yourself. Then we started into we gave a lecture about introduction of communication. Then we explained Mental Capacity Act, then confidentiality. Now we are going to start today a breaking bad news. Breaking bad news, one of the famous situation you could face in exam, may more than 60% of the case in the exam is breaking bad news. Breaking bad news, a lot of candidates consider it is a difficult case, and a lot of candidates consider it is a difficult to pass in station with breaking bad news. They consider breaking bad news case like a sea that facing people they can't swim. So today I will do my best to simplify it, breaking bad news and make it an easy. Now we will go through this sea and we will use this boat to go together inside the sea slowly and slowly until we cross it to the other side. Breaking bad news, let you first to enjoy by this lecture and give me your attention for the next few minutes that we will discuss the pathway of breaking bad news. If you are going through the sea with your colleague in a cruise, you have to rule. This rule that put it by the captain of the cruise. First rule, the boat captain is always right. Again, the first rule, the boat captain is always right. The second rule, if the boat captain is wrong, refer to rule 1. If you feel the captain of the boat is wrong, please again refer to rule 1 that said the boat captain is always right. So this diagram that we will see, or this pathway that we will discuss, that is right. No need to add more or no need to remove any information of this pathway. Everything you need is present in these lectures, and the only difference between case and the case is the title of the diagnosis or the cause of the breaking bad news. Let us to agree. Breaking bad news. An expert in breaking bad news is not someone who gets it right every time. An expert in breaking bad news, he or she is merely someone who gets it wrong less often. This is the wisdom. What is bad news? Bad news, any information which adversely and seriously affects an individual view of his or her future. This is breaking bad news. Any bad news, it's that affected seriously or adversely the future of patient. So that breaking bad news could be terminal cancer, palliative cancer, or treated cancer, or chronic progressive illness. This is This is the bad news, the definition of bad news. Please focus with me. Why is it important? It is important because it's frequent that we faced it usually in our life and during exam also. It is stressful when doctor is inexperienced, the patient is young, or there is limited perspectives for successful treatment. Also, we can say, in the breaking bad news, what remains unspoken is unspeakable. Give this in your mind, or put it in your mind. This is the message. What remains unspoken is unspeakable. What is the objective? Objectives of breaking bad news. When a bad news needs to be conveyed to a patient, there are 4 objectives that needs to be achieved during this discussion. We have 4 objectives. Number 1, number 2, number 3, and number 4. For number 1, please keep your attention with me. Assess the patient and the relative perception of their illness. What does that mean? It is not difficult. We explained it before. We explained before in introduction how to prepare the patient for breaking bad news. By asking the patient or relative how you feel now, or how do you feel now, how much you know about your illness, did anyone inform you why we requested this investigation for you, and lastly, what is your expectation about your illness. That is mean assessing patient relative perception of their illness. This is the first objective. Second one is giving the diagnosis and information. Explain what is the breaking bad news and what is the criteria and the management plan of this bad news. Number 3, support. We have to support the patient socially, or support him physically, or support for his relative according to the situation. We have to share and involving the patient in decision making and further management. So we have 4 objectives. Number 1, assess the patient relative perception of their illness. Number 2, giving the diagnosis and information. Number 3 is support. Number 4, involving the patient in decision making and further management. Till now, we are still going slowly through the sea. We didn't go deep and deep. We're still in the beach. We can return back. If you don't mind, we can return back again. But if you want to go deep and deep, please come with me. Now, we have steps for breaking bad news. Breaking bad news is not an subject everyone has to speak in it. You have to be confident during speaking. You have to know what is the best way of breaking bad news. If you enter your exam without arrangement previous best way in your mind how to break bad news, definitely you will not pass. So come to first thing in the steps for breaking bad news. If you would like to take coffee, please take it. No problem. Before you drink your coffee, you have to touch the cup. If this cup is hot or not, so that you have to prepare yourself first. You have to prepare the meeting with the patient. So, if you have a cup of coffee now, catch it before you drink. it may be still hot and you may get burn in your mouth. I know that it is very painful. So now we go deep and deep in the sea to know what are steps in breaking bad news. Number one, preparation. Before you drink, you have to feel the cup, if it is hot or not, if you will break bad news now or not. So preparation, as we said before, introduce yourself and identify the patient. Know all the facts and confirm agenda of meeting. Ensure privacy. Find out what the patient relative wants present. So that I will give an example again. So I will tell the captain to stop. You will not go deep now to the sea. Good morning, Mr. Ali. I am Dr. Ahmed, Senior House Officer in the Gastroenterology Department. Nice to meet you. Nice to meet you, Doctor. Mr. Ali, I confirm that we are here today to discuss the result of the camera test that done for you last week. Is that alright for you? Yes, Doctor, that's right. Out of respect for you, Mr. Ali, do you want any member of the family to attend this meeting with you? No, Doctor, go on. I would like to know what's about my diagnosis. Yes, I feel that I can go to Hollywood after this introduction. So, after you prepare yourself and prepare the patient in the introduction that we explained before in the introduction of communication that contains 4 or 5 steps according to for whom we discussed, if the patient or relative. So, first, preparation. You have to prepare yourself. Second step, what does the patient know? You have to check the mind of the patient, how this patient is thinking. How the patient is thinking in his illness. If the patient suspected he has a terminal disease or not, or if the patient suspected he doesn't have any serious illness, it's different from one patient to another. So that the first patient he has suspected that he has cancer, his response will be friendly with you. But the patient doesn't suspect cancer, the patient will feel frustrated and his response may be very angry about that and about the diagnosis of chronic illness. What does the patient know? We have to start by open questions. As we learned a lot, you have to open the view for you. So that, as I told you, when you catch your cup, when you drink the first one, you drink small amount. You have to taste it. You have to check. Even you hold it and it is not hot. The first you have to feel it. It is still hot or not. You are afraid from the ulcer. So that we are afraid here to break bad news directly. So that we have to start by open-ended questions. The start, as I said before, we have to tell the patient how you feel now. That's actually in our daily activity. Mr. Ali, how do you feel now? The first question. Please don't start any communication station without this question. How do you feel now? If you are speaking to the patient, or if you are speaking also to a relative, how do you feel now, or how your father feeling now? So it is a vital question. It is the first question to prepare the report between you and the patient. The next one, how much you know about your illness, and we said that before. The third one, do you know why we did the investigation and what we were looking for? The third question. By the other way, we can say also, what have you already been told about this illness? Number 5, what is your expectation about the result of investigations? So it is a comprehensive questions. We'll start by open one and tailored it to closed questions. So first one, how did it all started? As I told you, when you catch the cup of tea or coffee, first you will feel it, it's still hot or not. Then how much you know about your illness? Do you know why we did the investigation and why we were looking for? Number 4, what have you already been told about your illness? Number 5, what is your expectation about the result of investigations? These are 5 questions we have to build the rapport with the patient or relative. For the step number 3, is more information wanted? The patient brain is open and closed. He wants to know everything. Please don't force to give the patient information. And you have to tell him, would you like me to explain the problem as we understand it so far? Do you want to know everything about your illness? Are you the sort of person who likes to know everything about his condition? All the same meaning. You don't tell all this step, you have only to mention for him one. This need more information. You have to tell the patient about that after you giving him the diagnosis. Yeah. After this 4 or 5 questions, then you will breaking bad news. After that, you will tell the patient, is more information wanted? Would you like to know everything about your condition? Do you want to know everything about your illness? Any one of these 3 questions, you can use it. Now, giving a warning shot. You have to tell the patient or relative, I am afraid, it looks rather serious. Then inform him about the diagnosis. Or you can say, the result of investigation has been released today. Then silent pause for 2 or 3 seconds. It is not that as we hoped. Then silent. Then inform him about the diagnosis. Or you can say, I am afraid it doesn't look like a straightforward condition. Then pause, then explain the diagnosis. Or you can say, I am afraid that thing looks more complicated than we had hoped. Then explain to the patient. In one of 4 paragraphs, you can use it. So it is give a warning shot by speaking clearly and shortly, and start by always, I am afraid, I am sorry, this information is not straightforward, your diagnosis. This is a warning shot. Give time to the patient to allow denial. This is the wrong way. If you entered directly after you give the warning shot, it is wrong. So that you have to allow your patient to feel denial. This is the communication. Allow the patient to control the amount of information they receive by keep silent for a second. You have to keep silent, only second, not keep silent for 1 or 2 minutes. Ask the patient if he wants from you to continue the discussion or not. Then ask one of the following questions. How do you feel now? How does this news make you feel? I can see that was a shock for you. What is going in your mind? You have to respond to the patient emotionally through sympathy and empathy. This is allowed denial. We can go back again to summarize until this step. Sit please, take deep breath. You will tell the patient, how do you feel now? Yes, doctor, I still have shortness of breath. I still feel tiredness and easy fatigue. I can't sleep well at the night. I am sorry for that. Could you tell me how much you know about your illness? Yes, doctor. I have this shortness of breath long time, now for 6 months. I was thinking this problem related to my smoking, and I was told by my friend it is one of obstructive lung disease due to smoking. But it is bothering me a lot. I start to lose weight. Then I sought medical advice, and I went for GP. He requested for me imaging on the chest. Then he referred me for your consultant. Could you tell me also, Mr. Ali, do you know why we requested this investigation for you, or my consultant informed you why he is running this investigation for you? Yes, doctor. Your consultant informed me that he is looking for the cause of shortness of breath, because this imaging of the chest that done is not conclusive for him. Mr. Ali, what are your expectations about the result of investigation? Doctor, I am smoking for a long time, and this shortness of breath usually come for the person who usually smoke for a long time. And I have a lot of colleague smoker, and they complaining from shortness of breath. Maybe this related to smoking, and it could be simple thing. Yes, Mr. Ali. The result of the imaging of the chest has been released today. I am sorry to inform you that the result is not straightforward. Mr. Ali, the result shows that you have a nest growth. I am sorry to say that. This nostril growth is cancer. I am sorry, Mr. Ali, to inform this bad news for you, but this all the result that come for us. So that you did breaking, you giving warning shot. You have to keep silent for a moment. You have to allow the patient to control the amount of information that given to him, so that keep silent. This silent, the patient will not speak. You have to end the silent by saying one of the questions. I see that is a shock for you. Could you tell me what going you inside your mind? Mr. Ali, if you want to end this discussion now and then come back again to discuss your illness, we can do that. No, doctor, no. It's a shock, really a shock for me. Then tell him, Mr. Ali, do you want to know everything about your illness? Yes, doctor, actually, I want to know everything about my illness. This is the first 5 steps in breaking bad news. Then you have to allow denial. Don't go deep without cut the denial of the patient. If you go deep early, you will go through wrong way. So the first rule that we told and we speak about it from the start, the captain is right always. During a cruise, follow up the instruction of the captain. Second rule, as I said, if the captain is wrong, please return back to the first rule. he is right. After you allow the patient denial, I think now the cup of coffee is not too hot, so drink, don't be afraid. After you allow denial, so that the patient will be not hot. I'll give an example for the hot coffee. So you can drink now your coffee and we go explain details. You have to explain the details of the illness step by step. In short sentence, clearly, avoid any jargon. State the information simply, clearly, and sensitively. Provide information in small chunks. Avoid false assurance. Don't be discouraging. Be honest in your statement. Remember, multidisciplinary team and multidisciplinary professional support put in your mind. Don't start the treatment, please, again and again and again. Put this sentence in a circle. Don't start the treatment for the patient without saying for him, we are going to do for you multidisciplinary team. This team will include 1, 2, 3, 4. Please, again, don't start the treatment without telling the patient we are going through multidisciplinary team. Some candidate explain to the patient the treatment, and after he explained, he will tell the patient will go through multidisciplinary team. That's not right at all. You have to be organized. We are working together now to put you in the right way, so that you have to be organized from now. You have to tell the patient from the start there is multidisciplinary team who are looking after you. The content of this team may be cancer doctor, maybe chest doctor, maybe nurse, maybe palliative care team, your GB. So you have to mention it, please. You are not one-man show. You are not the doctor. Only one doctor cannot treat the patient. Put multidisciplinary team in your mind. Again, put in your multidisciplinary team in your mind. Now we reach the half of the sea. It is simple. See, we still have another half. We can cross it to another beach. After you explain the disease and what is the information and the management plan, including a multidisciplinary team, you have to ask the patient. And very, very important, please. Sometimes, as I said in the introduction, something not spoken, but it is running in the scenario. You finished all explain the illness. You have to ask some questions related to job of the patient. It could be the cause, and if you forget it, you will lose the compensation. Me, the patient working in mesothelioma, working in asbestos, and he developed mesothelioma. If you forget to ask him about his job, then you lost one of the ethical issue in this scenario. This is a compensation. Job is very important for each case. Smoking is important. Any medical problem in the past may be related to the new diagnosis. Who is taking care of the patient, or with whom the patient live? Any financial problem, so that it is a vital questions. Something are hidden inside the scenarios. Sometimes, as I mentioned before, you are speaking about the patient has Parkinson's disease. And one of complication of this Parkinson is dementia. If you didn't ask the patient who is taking care of him for whom, or who is looking after him in the home, you lost a lot of marks because you didn't treat the patient totally. So that you have to focus in your patient You haven't to focus only in the disease. This is one of the important rules in medicine, not in communication or history or clinically. Please focus in your patient. Don't focus the disease only. So that don't explain Parkinson's disease and forget to tell the patient about who is taking care of him for the house. Because this patient has risk of fall. The patient has dementia. Now we'll go to listen to concern of the patient. After you finish your task and pre-morbid state, ask the patient, what are your concern? Or could you tell me what's your concern now? Please, this is very important. You have to answer the concern once you asked it. One of the mistakes that could the candidate do it, he asked the concern, then the patient informed him about his concern and he go back again to explain something. No, not allowed, please. Once you ask the concern, answer this concern. You have always show the sympathy and the empathy for patient by saying it must be very hard for you. I can't understand, this is very upsetting for you. Or by another word, you can say every now and then, I am sorry for that. Don't depend on you informed at the introduction or in the breaking bad news, in the warning shot, you informed him about the sympathy. No, sympathy and empathy is a continuous process during all time of breaking bad news. So encourage ventilation of feeling. You have to allow the patient to speak, and the vital step to take patient satisfaction. Now we are going now inside the scene, and the cruise it goes smoothly without any problem. After concern and the plan of treatment and information to the patient, you have to make summary. You have to check understanding and giving help to the patient. Last step, over further. If any change in the future, you have to tell the patient. Any information or any other concern, you have to answer it. Ensure that patient is not left alone at the end of consultation, and think about whom they have at home with them for further support. So that, as I told you, breaking bad news, sympathy and empathy is a continuous process. Even after you breaking bad news and summarize and end of discussion and giving help to the patient, you have to ask him, who will drive you to home? If anyone is carrying you in the home, could I arrange anyone to drive you to the home? So you have to over further think. This is the 10 steps in breaking bad news. Now we reach to the other beach, but we still inside the boat. The captain always says instruction before he starts the cruise and during the end of the cruise. We'll go to pitfalls in breaking bad news. Pitfalls in breaking bad news. First thing, breaking bad news without exploring the patient well to know them. What does that mean? I have to take a consent from the patient at the start. Mr. Ali, we are going to discuss your illness. Is that alright for you? This agenda of the meeting. So that we have to take a verbal consent or implied consent from the patient. Next one is not established background knowledge. What is mean background knowledge? I mean here, you didn't ask the patient how do you feel now and how much you know about your illness and what is your expectation. This is a bit false in breaking bad news. If you didn't ask it, you will not give mark for it. By other word, I can say what is not documented, that is not done, not marked. If you break bad news early without preparing the patient by a reasonable warning shot, you will tell the patient, you have cancer. Or the result shows that you have cancer without warning shot. So that we are now at the end of the cruise and you have to take it. You have to prepare the patient to this breaking bad news. If you didn't, this is wrong. Don't delay bad news because you are fearing of the patient reaction. Sometimes patient treated for chest infection, and one of the common case I will explain it during the scenario, during interactive session. Patient wrong treated as gastroenteritis and doesn't respond to medication, and after that colonoscopy done and there is cancer. When you start to tell the patient about or preparing him, the patient was angry. Doctor, I have 6 months diarrhea. I went many times for GB and he told me many times I have irritable bowel syndrome and he prescribed for me medication and this medication doesn't help. I am sorry doctor, this is bad treatment. If you faced one patient like that in exam, you will feel frustrated. You will hide inside the desk. No. We are confident. We are discussed a lot of cases, such like this case. You have to sit in your chair and feel confident most of the time. Let the patient to say what he want to say. You have to react only by sympathy and empathy way, but you are the leader. You are the captain. You have to drive in the way that you want, not as the patient want. So don't delay bad news in a fear of the patient reaction. In such cases, tell the patient that I am sorry for what's happening, and I feel that it is a hard time for you, but also at the same time, let us to discuss what is going on with you now. You have to give him a cup of tea, not in the exam actually, but by your words. Give him a flower by your words. The tongue also always saying a good words, and he can say sometimes only a bad words. Don't delay the bad news in a fear of the patient reaction. Don't hesitate when you ask a direct question by the patient. Is that cancer? If the patient you told the patient, I am sorry to inform you that the result of investigation released today, and the result not as we hoped. The result showed that there is a nest growth. The patient may say, is it cancer? You have to be confident and don't hesitate. Don't tell him this nest growth, it is a probability of cancer. No, if it is written in the scenario, it is cleared cancer, you have to tell the patient, I am sorry to inform you that is it cancer. It is cancer. The patient maybe will tell you, are you sure, doctor? Yes. I am sorry to say the result of investigation that released, is it cancer? And we are sure about that. Please use the we, not I, because we are a team looking after for the patient. If the patient tell you I am going to die, doctor? You have to answer this question like political person. And I will say that in the next slides. Remember to break bad news at an appropriate time, to leave adequate amount of time to deal with the patient reaction. Other concern or discussion, other relative issue. Maybe there is some hidden issue like post-mortem examination, or don't attempt resuscitation, or compensation, or explain a procedure. Sometimes there is breaking bad news in patient. It is a probability of there is a probability of cancer that's not confirmed yet. You have lung mass and mediastinal lymph node, and the radiologist suggested that you have to take tissue snip from this mass, so that you have still time to explain the biopsy. Never say to the patient nothing can be done, or the patient will lose or hope. If the patient asks you, is there any treatment for such cases? You have to inform him, I am sorry to inform you that this type of illness is not curable, but we are going to treat any symptoms related to this illness. Be optimistic, don't be dishonest. Optimistic here by didn't say and didn't tell the patient about something not there. If the patient asked you, is there any treatment? Don't reply for that, maybe there is treatment. No. If the palliative treatment, yes, there is palliative treatment. It is different totally than the curable treatment. One of the pitfalls also, not exploring the patient information need. Not acknowledge the patient's distress. Not exploring the patient concern. يعني it is very يعني common question in exam. What's your concern? Don't forget it at all. So now we finished breaking bad news. Breaking bad news, as I mentioned, one of the common cases in the exam. Anything affect the patient future physically or mentally, we can consider it as a breaking bad news. Breaking bad news could be cancer, either this cancer is treatable, or probability of treatment for the cancer, like localized cancer without metastasis, or non-curable palliative treatment, or chronic progressive illness. We explained the introduction, and we explained the starting of or preparing the patient to breaking bad news, and we mentioned clearly breaking bad news multidisciplinary team. Again, please, I emphasize about that. Please, I emphasized again about multidisciplinary team. In any case, breaking bad news, and you have the patient is palliative treatment, ask the patient after you end of the pre-morbid state and socially history, do you have any advanced directive or living will? Maybe the patient wrote something and we have to consider it. Then end of discussion. Then ask who will give support to the patient in the home, who will drive him back to the home. We can arrange that. What are common questions in the breaking bad news? First one, the patient will tell you, is it cancer, doctor? If the diagnosis is established, you have to say, I am sorry to say that the diagnosis has been confirmed. You have cancer. And then leave time to the patient to feel and get information. If the diagnosis is uncertain, You will tell the patient like that. The investigation has been released and there is a lot of possibility that might cause your problem. And one of these possibility is cancer. But we are not sure about the final diagnosis, as we want to run some investigation for you to confirm the diagnosis. This is if you confirm it or establish you have cancer, okay. If not established, that's written in the scenario, you will take a biopsy to confirm the diagnosis. This is the answer of the question. Is it cancer or not? Next one, I am going to die. How long I have got to live? You have to reply, no one knows what will be happened in the future. So I don't like to give you figure. Everybody is different. It may be months rather than years, but it is unlikely to be few weeks. Let us look forward for control of your symptoms like pain and refer you to the team that will decide the plan of care. I am going to die, or how long I have got to live. Maybe the patient will ask the same question by another way when he tell you that, doctor, the wedding party of my daughter is after 6 months. Is there any possibility to attend this wedding party? The same question, I am going to die, it's the same. If the patient asked you, can it be cured? Or can this disease be cured? You have to answer that I don't see the disease will go away completely. However, we can do a lot of things to help you cope with it and make you free of pain and in a good shape. Last one, maybe the relative will tell you, please doctor, don't inform the patient about the diagnosis. One of the common questions also. We can reply, I appreciate that you know your father much better than us. However, having seen this situation many times before telling the patient the trust is usually what he wants and is best in long term. Most people know when there is something serious wrong and find out can be a relief. I would like to know that you doesn't want to know her diagnosis. Why? I would like to know why you doesn't want to know her diagnosis. I will talk to him or her and give him or her small amount of information. And if he or she doesn't want to know, I will not tell him or her about the diagnosis. Also, I want to emphasize about that your father or mother is competent and he or she can take their own decision. Simply, if the patient is conscious and has capacity, and this patient, one of his relatives speaking with you after consent from the patient, and the relative informed you that, please doctor, don't inform him about the diagnosis. We can reply by political way, I appreciate that you know your father much better than us. But in such cases, we faced many patients before, and it is better to inform him the trust from the start. As there is some plan of management, the patient will ask us why you will give me this medication and why you will do for me this investigation. And by the other word, your father, he is competent and he has the right to know everything about his decision, about his illness, and he can take on decision. But if I would like to tell you that I will give him small information about his illness, but if he want more and information, I will say for him about his illness if he want more. This is the answer of this question. Now we reach to the other beach, and as I said, breaking bad news, one of the simple and easy case in the exam. Don't feel frustrated if you faced breaking bad news. I feel you become more confident now after you listen to this lecture. And now we have a busway, we have a guide, and we have a boat. We can go inside it alone, inside the sea, without need any instruction from others. Breaking bad news, as I said, it could be for cancer or chronic progressive illness. I will give some tips and or message to put in your mind before end this lecture. Message number 1. Breaking bad news is a simple and easy case. Breaking bad news is always coming in exam. Breaking bad news is for chronic progressive illness or cancer. Chronic bad news could be related to genetic illness. Before breaking bad news, you have to prepare the patient. Preparing the patient, we have to take a consent for discussion with the patient. We have 4 to 5 questions we have to ask the patient about it. First one, how do you feel now? How much you know about your illness? This is the second one. Third one, do you know why we requested this investigation for you? Fourth question, what's your expectation about the illness? Then warning shot. You have to give the patient the warning shot by simple, easy, clearly sentence. By saying, I am sorry to inform you, the result released for us today, and the result is not as we hoped. And you have to keep silent for a second. After you finish the warning shot, another message, ask the patient, do you want to know everything about your illness? Then inform the patient about the management plan. And don't forget multidisciplinary team. Again, don't forget multidisciplinary team. Don't forget multidisciplinary team. Write it please in your hand. Don't forget multidisciplinary team. Say it before starting of the management. Say it before starting of the management. Say it before starting of the management. I repeat it 3 times. Okay? Management plan should include pharmacological and non-pharmacological management. You have to ask the patient about his concern. Please don't forget pre-morbid state. Please don't forget social history, job and with whom his live and the past history of medical illness. Maybe it is related to the cause of the illness, or the illness will affect his job. In the discussion, summary, check understanding and help, and last thing, please offer for the patient anyone to drive him to the home if he needs that. Advanced directive and leaving will, we have to ask it after we finish social history in last step in the communication. We have to ask it after we finish his job. What's your job? Do you smoke? who's taking care of whom in the home, or with whom you live. We have to, do you have any other advanced directive for living well? So this is a summary of breaking bad news. Finally, I hope that this pathway and this lecture make breaking bad news like an ice cream. You can eat it and enjoy it. So take this boat please and go through the ocean. Don't go through the sea. Go deep and deep and deep and find more and more cases and practice more and more cases in the breaking bad news, and you will be get more and more information, and at the same time your practice will be improved with the time. Listen to this lecture alone, it is not a solution for the problem. Listen to lecture is one part, but the remaining 9 part out of this 10 parts is practice, 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 practice. 9. Practice is the only step that if you did it well, you will pass. Practice by your tongue, not by listening to others during practice. Now, I will express again about my deepest thankful for Dr. Khatib, as I am always submit for him lecture at night, and he start to working on it to put it in the social media for others. Thank you.